Canada has free healthcare. You've heard that. But what most new permanent residents don't know is that when you first arrive, you may not be covered at all, and one hospital visit without insurance can cost thousands of dollars. There's also life insurance, tenant insurance, and disability coverage, each one with PR-specific rules you need to understand before something goes wrong. In the next 8 minutes, I'm going to give you the complete insurance framework for new PRs in Canada in 2026. Let's protect what you're building. Let's start with the biggest myth in Canadian immigration. You've been told Canada has free healthcare, and that's true, eventually. But most provinces have a waiting period before your provincial health card kicks in. In Ontario, BC, and Quebec, Canada's 3 most populated provinces, that waiting period is 3 months from when you establish residency. In Alberta, Manitoba, Nova Scotia, New Brunswick, and PA, coverage is immediate. In Saskatchewan, it's 3 months. What this means for you practically, if you arrive in Toronto in January and get sick in February, you are not covered by OHIP. You will receive a hospital bill. An emergency room visit in Canada without coverage can cost anywhere from $5,000 to $20,000 or more depending on treatment. This is not a small risk. It is the most financially dangerous gap in your first year in Canada, and it is easily solved with a simple temporary private health plan. Step 1. Get temporary health insurance before you land, or on your very first day in Canada. These are short-term private plans designed specifically for the provincial waiting period. The best options for new PRs in 2026 are Manulife CoverMe, Sun Life's Visitors to Canada Plan, Cigna International, and Blue Cross Visitor Coverage. These plans cost between $50 and $120 a month and cover what matters most during the gap: emergency room visits, hospitalization, ambulance, and urgent prescriptions. They do not typically cover routine checkups, dental, vision, or pre-existing conditions. But that's not what you're protecting against. You're protecting against a single unexpected emergency that could wipe out your entire first year of savings. One critical tip: buy the plan before you fly to Canada if possible. Some plans have a 48-hour waiting period after purchase before coverage begins. Apply for your provincial health card on your very first day in Canada. Even if your province has a 3-month waiting period, you need to apply immediately because the waiting period clock only starts from the date of your application, not the date you landed. If you wait 2 weeks to apply, you wait 2 weeks longer for coverage to start. Documents you'll need: your confirmation of permanent residence or PR card, proof of your Canadian address, lease or utility bill works, and your SIN if you have it. Each province has its own portal: OHIP in Ontario at ontario.ca, MSP in BC, AHCIP in Alberta, and RAMQ in Quebec. Apply, then keep your temporary private plan active until your provincial card arrives. The moment your provincial card is in your hands, cancel the private plan. Once your provincial health card arrives, here's what it covers: doctor visits, emergency room, hospital stays, surgery, blood work and diagnostic imaging, and maternity care. These are the big ticket items and they're genuinely free at point of service. But here's what it does not cover, and this surprises almost every new PR. Dental care is not covered by provincial insurance. Prescription drugs are mostly not covered except for specific programs. Vision care, glasses, contacts, and eye exams is not covered in most provinces. Physiotherapy, mental health counseling, and in some provinces even ambulance fees are not covered. When you start a new job, ask HR on day 1 about the group benefits plan and enroll immediately. These plans often have enrollment windows. Miss it and you wait a year. Life insurance. Do you need it as a new PR? Here's the honest framework. You need life insurance if someone financially depends on you. That means a spouse, children in Canada, or family abroad who rely on your monthly remittances. If you were to pass away tomorrow, would someone lose income they depend on to survive? If yes, you need life insurance. If you're single, have no dependents, and no one relies on your income, life insurance is not your immediate priority. The right type for most new PRs is term life insurance, coverage for a fixed period of 10, 20, or 30 years at a predictable monthly premium. On a healthy, non-smoking 30-year-old, a $500,000 20-year term policy typically costs $25 to $40 per month. As a permanent resident, you have nearly the same eligibility as a Canadian citizen. Manulife, Sun Life, Canada Life, and Empire Life all treat PRs as standard applicants. A simple rule for how much life insurance you need. Multiply your annual income by 10, then add your mortgage balance, any significant debts, and an estimate of long-term dependent costs. A $70,000 income earner who supports family abroad with $500 a month in remittances needs roughly $700,000 to $800,000 in coverage to replace that income and support for a decade. A couple with a combined $130,000 income, a $400,000 mortgage, and one child needs closer to $1.5 million in coverage. Those numbers might sound large, but term life insurance is extraordinarily affordable when you're young and healthy. The easiest way to compare rates is PolicyAdvisor.com. It searches over 30 Canadian insurers simultaneously for free, takes about 10 minutes. Always buy life insurance while you're young and healthy. Every year you wait, premiums go up. Tenant insurance. For $20 to $35 a month, Tenant insurance protects all your belongings against fire, theft, water damage, and covers your liability if someone slips and falls in your apartment. It also covers your temporary accommodation costs if your unit becomes uninhabitable. Think about everything you own: laptop, phone, clothing, furniture, kitchen equipment. Most renters have $20,000 to $50,000 in belongings without realizing it. One apartment fire and all of that is gone. Without tenant insurance, you rebuild from zero at your own expense. The best online options in 2026 are Square One, Sonnet, and Intact. All offer instant online quotes and coverage that starts within hours. And many Canadian landlords now require proof of tenant insurance before they'll let you sign a lease. Get it on day one. Disability insurance is the most overlooked protection for new PRs, and potentially the most important one. 1 in 3 Canadians will experience a disability lasting 90 days or more at some point in their working life. If that happened to you, how long could you survive without your income? Disability insurance replaces 60 to 70% of your income if illness or injury prevents you from working. Many Canadian employers include short-term and long-term disability coverage in their group benefits plan. If yours does, enroll on day one. If your employer doesn't offer it or you're self-employed, private long-term disability insurance costs between $50 and $150 a month. Your income is your most valuable financial asset. A $70,000 salary over a 30-year career is $2.1 million. Protect it. Here is your complete insurance action plan. Before you land or on day one, buy temporary health insurance through Manulife, CoverMe, or Sun Life. Apply for your provincial health card immediately to start the waiting clock. Get tenant insurance online through Square One or Sonnet. It takes 10 minutes. In your first week, review your employer's group benefits package and enroll in every plan available: dental, drug coverage, vision, and disability. In months 1 to 3, keep your private health plan active until your provincial card arrives. If you have dependents, compare life insurance quotes on PolicyAdvisor.com. Here's the summary. Most provinces have a 3-month waiting period for public health coverage. Buy temporary private insurance before you land and apply for your health card on day one. Provincial health covers the big stuff, but not dental, prescriptions, or vision. Get group benefits through your employer as fast as possible. Tenant insurance costs $20 to $35 a month and is non-negotiable. Life insurance is critical if anyone depends on your income. And don't forget disability insurance, it protects your income if you can't work. If this helped you understand what insurance you actually need as a new PR in Canada, hit like and subscribe to PR Wealth Lab. Comment below. Which province did you land in, and have you sorted your health coverage yet?